Good morning everyone and welcome to today's conversation with Professor Siedine Coetzee. It's really a privilege to have her here today. She is one of the only two nurses appointed as research chair by the National Research Foundation, and the other research chair is Professor Siedine from the University of Pretoria. But in that regard, Siedine really made history in nursing in South Africa. So congratulations on that, and we are very proud of you, and it's really a privilege to know you. And also together with that, Siedine is very humble, so thank you for being here today.
Thank you.
A research chair is a faculty member that's recognized internationally as having the potential or already influencing national and international research and really making an impact through research. So thank you for all of your efforts in that, and well done on that. Would you like to tell us more about yourself and about your research?
Okay. First of all, married with 2 kids, so as much as my heart first just beat for research is subdivided in many ways, but my heart is still for research, and within that specifically looking at nurses and nurse outcomes is what I focus in. Since I started my master's right through to my PhD and now in the research chair, I think what we know is that 80% of our healthcare workers are nurses, so if we could influence nursing, imagine how we could change healthcare. So that's been my focus from my master's study. And then I did my postdoc in Canada with the late Prof Siedine, and that was an amazing experience, and I always miss her. And I think that's also part of becoming a research chair, is you have these giants in your life that have made so much influence, and you could never have been where you are today if you didn't, you just started on a different block than they did, because they would have started small and built this empire, and you just immediately move right into their empire and move further from there. So I don't think a research chair is anything you ever do without a network and with great mentors.
Great, wonderful. And you said that your research chair, the name of the program is Synopsis. Can you tell us a bit more about that, please?
So Synopsis is something I chose. The acronym means something, but it's also a play on the word of actually synopsis, which is an overview from above. So my research program and what I'd like to do in the chair is to have a synopsis of nurses, but broader than that, of healthcare. So synopsis is the acronym SANOPSYS. So the SA is South Africa, and then it's nurse, patient, organization, and system outcomes. So that is based on the Institute of Healthcare Quality, which says to improve quality in any healthcare system, there's 4 things you need to look at. You need to look at the health of your healthcare workers, that's physicians, doctors, anyone working in the hospital. You need to look at their health, their mental health, their well-being, their job satisfaction, so to ensure they're committed. Because if you have a committed and healthy person, you have good care. The second they look at is the organization, which is cost containment, right? The less mistakes I make, the less costly the care is. They also look at patient satisfaction, and then the organization, right? So that's the 4 objectives I want to plan on in the 5 years. So the first one I'm obviously looking at is my passion, that's nurse outcomes, and that's currently what I'm busy with. So I was involved in a study with Prof Linda Aiken in 2012, the Orange Forecast, while we were busy from 2009 to 2012, and we looked at nurse outcomes and their perception of patient safety and quality of care. So I've broadened that now. We only looked at medical, surgical, and ICU nurses. I'm now looking at every type of specialty, and also looking at every province, and also for the first time looking at every type of nurse we have. So from a professional nurse all the way to auxiliary nurse, because I really want to understand also what all categories of nurses have to say. Because I think it's going to be very similar. How a nurse views perceptions of safety is going to be the same how auxiliary nurse, because we know auxiliary nurses spend a lot more time with patients often. So that's a new addition I'm doing there. And then from there on, we're going to look at patient outcomes. And there I've included programs that are already existing. Like when you look at patient outcomes or their patient safety or quality of care, you're looking at their experience. So that's typically where my research of compassion practice comes in, and caring presence. And you look at the effectiveness of the program, so that's more your evidence-based research. So there I worked with Corin Minnie's focus and Velma Libber and those persons who are looking at more evidence-based practice. And then you're also looking at their quality. And then the next thing we'll be looking at is organizations. So what my thinking is going is, now I've collected nurse outcome data and I've looked at patient satisfaction data, and then I want to go to the hospital and find out what's the actual data. So if nurses have said, I intend to leave, how many have actually left the organization? So you get the database from the organization, see what was their staff turnover, what is their absenteeism, how many medication errors was there in the ward. So you can see, how does this compare nurse perceptions to what actually is recorded in HR data. So I want to see, because a lot of research says how nurses perceive is very accurate to what is actually happening. So I just want to test that hypothesis. So that's the organization, and then system is my baby. So the system is the final step of what I envision, and that is we want to develop an institute of excellence and develop leadership and governance. So I'm looking at 3 focuses within that. I would like to have a place where we train. So we know a lot of managers, there's things they struggle with. I had a PhD student that finished her PhD this year, and they really struggle with things like budgeting or planning a roster, or how do I support my staff. So looking at training them in these short courses. So where's the need, and then they can do training. So that will later fund the institute. Then the main goal for me would be to identify people who have just entered practice at 0 to 5. Because research is showing us we lose most of our nurses from 0 to 5 years. So that means we have the wrong approach with our new nurses. We tend to give them the donkey work or the brunt work. And actually, if we can identify this one's going to be a very good researcher, this one's going to be an excellent manager, this one's going to be an excellent clinical nurse, and we can mentor them and get them in the right career path, we could actually change nursing. So that would be the institute's role. I would want to work with nurses of 0 to 5 years, and then work with mentorship and training. I'm not completely sure how it'll work yet. That's part of the plan. We have several institutes in the United States and Europe, so I would like to go and see what they're doing and then bring it to Africa and see how we can contextualize it here. And then my 10-year plan from there on is to roll it out in SADC. So later it would be that this institute it's running by itself. So it's not dependent on other research funds. Yeah, that's the plan.
Wow, that's wonderful. Thanks for sharing that, and I really hope that that plan comes to realizing, and that it will, I believe that it will make a big difference in nursing and in healthcare. Then, so wonderful.
Thanks.
Wow.
So I just want to add, I read a quote the other day that says, you can have the best system, you can have the best organization, but if you don't have a good leader to run it, it'll never work.
Yes.
And part of that institute, I also want to see it as a bottom-up approach. So with training and mentoring, but I also want to hear from ground level. If you saw the presidential report, I think of 2018, they were saying that the biggest problems they have in practice is corruption and waste. So how will we ever, as researchers, not be involved in practice, be able to tackle these things? We need these leaders on the ground that's going to help us to get interventions on their level that we can bring up to the policy. So that will also be part of the institute, to see what is the problems they're experiencing and how could we possibly give recommendations or get involved in policy to change this.
Definitely. Now I see a link with presence there, is the idea of understanding their reasons why they are doing the things they are doing in the way they are doing it, so that from there we can build on that and improve. And yes, so wonderful. Now, what link do you see between presence and your research?
Okay, so my research, as I say, is in nurse outcomes, but my favorite part of that, and where I always include in the instruments, is looking at compassion practice. So that's compassion fatigue and compassion satisfaction. Of when I nurse a patient, sometimes it can start making me feel drained inside, and other times it just elates me and I feel like I can do this forever and it's the best job in the world. And what is that switch? Because we see that when you start nursing, and any lecturer will know when you interview that first little for that person that wants to come study nursing, you ask them, why did you choose nursing? They're like, because I love caring for people. But later when you see them in their 4th years, they really they want to be finished. They feel like they may have made the wrong career decision. Why? What happened? And how can we protect that we can increase the compassion satisfaction? So caring presence is for me similar in that it's trying to understand someone's worldview. And if you can, if I can converse with you and I can understand what you need in the situation we share, and I can give you the correct action or response, then you're going to be satisfied and I'm going to feel satisfied because you had a positive response.
Yes.
So I was speaking to Shane Sinclair this week just by email, and he's an expert in compassion. And he gave me the most amazing analogy. He said to me that he sees compassion or caring presence, I really think you can use both, is different for every area of the world, right? But we can compare it to cuisine. So Italians, we know they like pasta. That's different than South Africa, right? We do eat pasta, but it's not our main cuisine. But then the interesting thing is when you go to Italy, each part of it has a different type of pasta, right? So caring presence, compassion, it's very individualized. I mean, we can't say caring presence is this to South Africans. We can't say caring presence is this to nurses. We can say each one has their type of food. Compassion means something different to everyone. A caring presence means something different to everyone. So that's the goal of caring presence, is to try and understand, how do I meet your need in the way that you will understand it? Because I can always think, when you're a mom, you can have children in your house and you can say you're spending time with them, right? But you can still be busy cooking or cleaning or packing away. That is different than when you actually sit and you look at them and you try and understand them. So for me, that is caring presence, is that really that relation building, is being present, it's trying to understand what you need. And for me then compassion goes to, how do I meet that need? And then the response you give, was it a positive or a negative? And compassion fatigue for me then leads to, if I keep getting a negative response, it's draining me, right? Because I'm putting all this energy into you because I think I'm really meeting your need. I really want to help you. But then the response I get, either your outcomes are decreasing, like your physical condition is deteriorating, or there's physical abuse. We see that a lot amongst nurses now, from patients and from family. There you can see physical abuse towards nurses. Or my workplace, I'm getting very negative feedback from my managers or from the family or the patients. And that's draining me, right? Because I'm investing energy. I'm taking the time to understand, but the feedback I get is negative. So that drains me. And how can I understand so that we can make that a positive experience? And I think it's that thing where we think one size fits all. It's not. You have to have caring presence to understand what this person wants before you can act.
Yes. Wow, that's very interesting, and it's really also inspiring me to go and do something in practice and to try this out and see how it works. And I'm really I'm looking forward with you to the results that you will see and the difference that the Research Chair Program and the Institute will make. So thank you so much.
Thanks very much.
Yeah.
Thank you.
Thank you.